Thank you for letting me speak today. I have been in Galveston at a reunion, and I don't know, the air and all that got me all stopped up, but I'll try my best. First Texas Home Health. Anybody know what home health is? First Texas Home Health has been in Sealy for 16 years, and I've been working this month 12 years. I do business development, and that is unheard of in my business. So I love what I do. I get to go out and like over at Chanew's at Rose Hill, I do a lot of programs in the community for seniors. It used to be where we were just geriatric. Home health was just geriatric, but with insurance, we've seen, we even saw a child that was in an accident, but most of it's for seniors that are homebound. And what home health is you try to keep them in their home as long as you can, independently, and through nursing therapy. We have LVNs and RNs. We have speech, occupational therapy, and physical therapy. And so they have to be homebound or basically homebound. You can go and get a prescription or go to church or even get your hair done. But but you're supposed to be homebound basically. And we go in with a doctor's order, and it has to be a doctor's order, and take care of them as long as it's necessary. It used to be, things have changed with all Medicare and the insurance companies, so we're a little bit more limited taking care of them than we used to be. It's very rewarding, and I guess when you're in a small community like this, you get to be family, and we truly, follow them and keep in touch with them. I get to go to the hospital and see them when they're in the hospital. Of course, the nurses and the therapists go to their home and see them. Oh, one thing I forgot to mention, we have a social worker, and he's called a medical social worker. And so it's not like APS social worker. He comes in and gets them lots of things. One thing we were talking about earlier, I don't see her. We were talking about, it's very hard to get medical equipment now. About 2 years ago, they had what they call competitive bidding. And it used to be where they could get the wheelchair and the walker, you just call and they're there, the oxygen. Now it's extremely hard to get that. So what we have in our office, and if y'all, any necessities, we, along with the American Legion, collect gently used equipment. Not a bed, unfortunately, we can't store that, but wheelchair, walker, bedside commode. You would think they'd automatically get that, right? Nope, they don't. And if they order it in the hospital, which that's not always the case, then it comes. So we lend them to them. So we have a program with the American Legion. If you know anyone that has any of those items, please drop it off, and it will be used and reused and reused. Any questions about home health? Anybody's family ever been on home health? I know Chanew knows. Yeah.
How many clients do you have?
How many clients do we have? We have 3 offices. We have an office in Fulshire, Sealy, and Weimar, and we're the 3 down here, and then we have an office in Wichita Falls, Whitesboro, Texas, and Decatur. We have between 180, 250, something like that. And it used to be where you kept them on for a long time. Well, you don't do that anymore. You got to get them off quick. There's certain legalities, and certain diagnoses. The families are very involved when we go in, say to set them up. We always want a family member there to be the extra ear for them to hear what we're going to come in and do.
And you cover Weimar, you said?
We do. We actually go from Highway 6 to LaGrange, and then 59 to 290. So all in that area.
At what point are you not able to help them at home anymore, and then they need to go to services somewhere?
That's when it's when they're in danger or an endangered situation. Then we have Colonial Bell Nursing Home or an assisted living, move with their family. Now with the storm, we had people displaced everywhere. And can you imagine in Houston what that would have been like? So that was a little hard to find them, but that's what Colonial Bell's for. That's what Rose Hill is for. Rose Hill would be their first option to go to, and then when they couldn't do that anymore, then she has them going into the nursing homes. So there's, and we don't go into the nursing home. We do go into assisted livings. We take care of them at home or in assisted living. They take over and they have the nurses and the therapists in Colonial Bell.
Is this a non-profit organization?
We get paid by Medicare and insurance companies.
Do you do any private pay?
We do. We also do private pay, yes. And there are people that they don't have, like a lot of times you'll call in, and what we do is we get the, someone gives, like say the hospital, and we have to call in to Medicare or the insurance company to verify everything. They might have a $5,000 deductible. So, you know, we work with them on that. We also have done indigent people, you know, the hospital will call, we'll do that. We try to just reach out any way we can. Anyone's always welcome in the office to come in and talk, get their blood pressure done. October the 28th, we're doing a health fair along with the chamber. October 25th. I'm doing something else the 28th. Over at Leader Toffel, and it's for all the seniors to come in and get information. It's free to them to come in, and we serve lunch. We usually have around 100 people that come in, pass the word around, and I don't have the flyers today, unfortunately, but we'll have them all over town.
What do you do exactly on that day?
Just come, like someone will be doing flu shots, blood pressure, glucose, information, like Patsy and Shanu will be there with their information. A lot of people, you think that everybody knows what this is. They don't. You know, they don't have any idea, or their family members don't. Usually we want the family to be involved as much as possible. If not, then the social worker, you know, is there to help for that. Any other questions? All right, thank you.
Very good. Thank you very much, Ann.